I'm ready to spin the big wheel of birth. Let's do it. Oh, okay. Today we have midwives. Midwives are care providers. So midwives are trained professionals. So there's a couple of types of midwives. We have the traditional hospital setting midwives, and they have a nursing degree and a master's in midwifery. And they can take care of women for the full spectrum of health for OBGYN health. And so they can do well woman care, they can do deliveries. And the only thing that midwives don't do that is a little different from an OB is work with high-risk patients and do surgeries on their own. But other than that, midwives can do so much. And working with a midwife, it can be a little bit different than working with a classic OB doctor. A lot of times we see midwives follow a different philosophy of birth, that they really view birth as a normal occurrence and not pregnancy and birth as a sickness that needs to be treated. So a lot of times we see kind of a difference in philosophies between midwives and OBs. This is a generalization, so it's not every single midwife, every single OB, but in general, midwives tend to have a philosophy that birth is a normal, natural, physiologic process and tend to honor those physiologic birthing principles. Sometimes I have talked to people that say, well, if my insurance will pay for a doctor, why would I have a midwife? Which is a really great question. Midwives have a different type of care. Like I mentioned, their philosophy of birth. Sometimes you see that they practice a little differently as far as testing goes, as far as number of hours with patients, but their skill level and care is very much the same as far as you would be very well taken care of if you went to a midwife as opposed to an OB. I really encourage people when they start their pregnancy journey to do some interviews. Don't necessarily go to the care provider, the midwife or the doctor that you've always been to. It's good to kind of talk to them about their ideas about labor and birth, find out about the hospital that you're birthing at. And at that point, if you haven't interviewed midwives before, definitely I would consider interviewing them so you can get a feel of how they're different. So those are hospital-based midwives. There are a couple of other types of midwives I'm just going to touch on. Certified professional midwives. So those are midwives trained in an apprenticeship model, and they generally practice either at a birth center or at a home birth settings. So those are CPMs. And then there's lay midwives who follow more of an apprenticeship training as well. And they have different professional standards. I'll try to put some links below just for more information. So midwives are amazing. I have worked with many great midwives in my career. And I think that if you have especially a low risk pregnancy, I would really consider talking to some midwives and see what you think about the difference in philosophy. If you have thoughts on midwives, please let me know in the comments. I would love to hear. And thanks for joining me today on the big wheel of birth. I will spin again tomorrow. If you are enjoying the content, please give me a like, subscribe in YouTube, and you can get a notification for when the next video is set up. Okay guys, have a great day. Bye.